CPR for children. Firstly, ensure an ambulance has been called. The child needs to be placed on a hard surface, maybe the floor or a counter that you might use to change their nappies. Now remember, with children, we start with the breaths first. This is mainly because the child may collapse primarily from a lack of oxygen. It's unlikely that they'll have some sort of heart attack or a stroke like an adult might. They need the oxygen. That's what's going to be the cause. We start with 5 breaths first. So we need to make sure the airway is open, the nose is pinched. And if you're using a resuscitation face shield, then we need to place that. We're going to give them 5 initial rescue breaths. And then we're going to move on to our chest compressions. When carrying out CPR on a child, just use one hand. So when we're carrying out chest compressions on a child, we're going to actually compress 1/3 of their overall chest depth. We're going to do that 30 times at a rate of 2 per second, giving us an overall rate of 100 to 120 compressions in a minute. We're then going to move on and carry out 2 rescue breaths in a similar fashion that we carried out our initial 5, ensuring the airway is open, the nose is pinched, and we see some chest rise and fall. And then we'll continue 30 to 2 until the emergency services arrive. Or we see a positive response from the child in the form of their level of consciousness increases, they start to move their arms and legs purposefully, or we need to move the child because the situation becomes dangerous.